I think I might be the tallest person presenting, so I'm just going to play around with the mics a little bit. This is the downside of being 6'7". So kia ora katoa, as Annette said, I'm going to be talking about LGBT, lesbian, gay, bisexual, transgender, young people, and suicide prevention in particular, how we can make a difference, a couple of projects that I've been involved with. I'm going to start with talking about definitions. As Moira already mentioned, the terminology in the field is fraught, so I'm going to do a little bit on terminology. Then I'm going to talk about suicide in this population, and then briefly discuss two projects that I've been working on in terms of, with others in terms of making a difference. So there's a picture there you'll see on the presentation, and a sort of rhetorical. I took out the question mark because it's sort of so rhetorical. I took it out, but you'll see a whole lot of terms there, and in a picture, and you can't tell anything about the young person in terms of their sexual orientation or their gender identity based on a picture. But if we think about sexual orientation, this is mostly conceptualized with three dimensions. So we have sexual attractions, sexual identity, and sexual behavior. Sexual attractions, you'll see some of the terms there on your right. Are they same-sex attracted? Is the young person same or both sex attracted? Are they not sure of their sexual attractions? That's probably the most useful dimension to use, especially with young people when they're learning so much about sexuality and attractions as they're growing. And then we've got the sexual identity labels. That's lesbian, gay, bisexual, takatapui. The list is quite extensive. And that's basically the terms that people use themselves to define their sexual orientation. You'll probably be familiar with LGB, or lesbian, gay, bisexual. Takatapui is a Māori term. It means intimate companion of the same sex, and then that's taking into account more than one dimension, because you're talking about identity in terms of culture as well as sexuality. And then there's sexual behaviour. Sexual behaviour isn't particularly useful in terms of understanding sexual orientation in young people, because most young people under the age of 18 haven't had sexual intercourse. So, and I'm basing this on the Youth 2000 data, so it's not that helpful in terms of us making sense of sexuality or sexual orientation. The other terms there, at the bottom of the picture I have trans with question mark, transgender. Those could be a young person that's born, biological sex might be female at birth, but they're actually male, identify as male, live their life as male, they're a young man. And so that's important in terms of understanding gender diversity, which is also quite complex. As an umbrella, it encompasses all people that don't neatly fit into a conventional gender binary. And Moira already talked about intersex individuals as well. And then on top of all of that, to make the whole area in terms of terminology really rich and quite complex, we have lots of different cultural understandings around sexuality and gender diversity. So, for example, I think most people will be familiar with whaawhine, whakaleiti, all different types of ways in which gender and sexuality can be understood, and I deliberately don't separate those out in terms of sexuality and gender diversity because there is overlap there. When I'm talking about sexual minority youth, I refer to LGB young people, or young people based on their sexual attractions. So young people that are same-sex attracted, both sex attracted, not sure of their sexual attractions. And gender diverse, like Moira was saying, includes a huge cross-section of people and includes transgender and trans individuals. Youth 07 and the Youth 2000 surveys are really, really useful because they are nationally representative. So there was a survey conducted in 2001, 2007, and last year in 2012. 2007, that survey involved more than 9,000 young people from throughout New Zealand. So these were young people randomly selected, their schools were randomly selected, and they were asked a whole series of questions. So everything from oral health, how often do you brush your teeth, those sorts of questions, to questions around mental health and well-being, as well as items around sexual attraction. 6% of the young people that were surveyed in Youth 2007 were sexual minority youth. That's the young people that are same sex, both sex attracted, not sure of their sexual attractions. We're also really fortunate in New Zealand in that we have the Christchurch Health and Development Study, and it's useful to look at the results from the Christchurch Health and Development Study because we can see how they compare and contrast. They're different studies. One is longitudinal, one is looks at associations and correlational research, but the Christchurch Health and Development Study also asked the participants about their sexual orientation. You'll see there 2.8% were LGB, and you'll be like, well, that's 2.8% in that study, and there's 6% in Youth 07. That's perfectly understandable because you're going to have a greater proportion identifying as being same or both sex attracted, not sure of their sexual attractions, and a smaller proportion that will identify with the sexual identity labels like LGB. As Moira was saying, in Youth 07, most of the sexual minority youth were healthy and well. They didn't have depressive symptoms, they weren't feeling suicidal, and it's important to highlight that because I think in this field it's a bit of a two-edged sword. You want to make the case that this is a small population numerically speaking with real challenges, but also you don't want to further stigmatise the population as well. And here's some of the results from the study that we looked at based on the secondary analysis of the Youth 07 data. This was published, and we separated out the subgroups. So we looked at those that were exclusively opposite sex attracted, and we compared that to those that were same sex, both sex attracted, not sure and neither. And you'll see the little red box there, that's the orange actually, is the sexual minority youth. And if we look at current depressive symptoms, which we know is a risk factor for suicide, I have to remind myself, just under 10% for the opposite sex attracted young people, and then between 21% to 32%, or nearly a third, for the both sex attracted young people in terms of depressive symptoms. In terms of suicide attempts, you'll see that it's particularly concerning for the young people that are both sex attracted, where we have over 20% of the both sex attracted young people compared to 4% attempting suicide, and that's attempted suicide in the previous 12 months. We also looked at deliberate self-harm because that is important in relation to risk factors around suicide, and that was for the previous 12 months, and it's anything that you've attempted to do that you thought might harm you or have even killed you. I'm paraphrasing slightly, but it's important because of the points that Mark made earlier about intentions, and we're not really 100% sure where the intentions were with that particular item, but over half of the both sex attracted young people had deliberately self-harmed in the previous 12 months, and the other two groups, the sexual minority youth and sexual minority youth overall, were at increased risk. This is not new. The Christchurch Health and Development Study has found similar increased risk, and that's from 1999, so we're talking over a number of years that the LGB young people are at risk. The rates of major depressive disorder for LGB youth is nearly 3/4 compared to under 40% for heterosexual youth. So that's major depression between those youth years, 14 to 21, and ever attempted suicide, approximately a third of the LGB youth from that study. Sexual minority youth were also, from the Youth 07 data, were more likely to seek help for emotional worries, but also experience more difficulty attempting to get this help. And we'd hypothesise that as being the difficulties finding clinicians, support people that were supportive of these young people. It's really challenging to find the right type of help. In our Youth 2012, we've got some manuscripts in preparation, which is quite exciting. I can't go into huge amounts of detail, but you'll notice that I talked about LGBT or sexual minority youth from Youth 07 and not the transgender young people. That's because there's no items in the previous surveys around gender diversity, but in 2012 there was an item that was added thanks to Terry Ann Clark, who leads the group, had led that survey, and also the group, Adolescent Health Research Group more generally, that there was an item around gender diversity. And what I can say is that transgender young people are at elevated risk of suicide attempts, which is probably no huge shock to people, but it's really useful in terms of having that information at a national level from a representative survey. And also we've got a manuscript in preparation looking at the results across 2001, 2007 and 2012 for sexual minority youth, and we see this consistent pattern with suicide attempts being an issue for the sexual minority youth across those surveys. So why are LGBT youth thought to be at increased risk? There's family rejection. Unlike other minority groups, usually you share your minority status. I come from a Dutch migrant family, and so I've been surrounded by people that ate strange cheeses, wore funny shoes, that sort of thing. And so you have other people, if you're in other minority groups, that are generally sharing that experience with you. But for the gender diverse and sexual minority youth, you don't generally have that. So family rejection and tensions can be an issue. Also substance abuse. Now in pink I've got increased rates of bullying and victimisation and increased rates of mood disorders, in particular depression, and that's because the two interventions I'm going to discuss target those particular risk factors in terms of helping to reduce suicide. So one is Rainbow SPARX, looking at treating depression, and the other is about Rainbow Youth's education program, looking at reducing bullying. So this is an image from SPARX. It's a computerised form of cognitive behavioural therapy, and there are 7 levels that are completed sequentially. Associate Professor Sally Mary led the development and evaluation of SPARX, and I was part of that team, and SPARX was evaluated in a randomised controlled trial. As part of that process, I decided to do my PhD, which was interesting in itself, doing that little journey, and looked at whether or not the first stage of the research was looking at whether or not SPARX needed to be adapted for sexual minority youth. And so I conducted a series of focus groups some years back now with sexual minority youth, asking them what they thought of prototypes of SPARX. And the sorts of things they talked about are the things that have already been mentioned by Moira and Helen in terms of homophobia, heterosexism, that's the assumption that everyone is heterosexual or ought to be heterosexual, and the challenges in their environments, in particular challenging school environments, sometimes really hard home environments as well. As a result of that consultation and the feedback from the focus groups, we made a call to develop a rainbow version of SPARX. So sort of I've got some images there of the actual program, and that included the content that the young people from the focus groups really wanted us to add, and like heterosexism, homophobia, how to cope with coming out and so forth. And we conducted an open trial. There were 21 sexual minority youth. You'll see there were 44 that expressed an interest. The study was Auckland based for practical reasons, for doing interviews and face-to-face sessions with young people pre, post and follow-up. So there were people that had expressed an interest outside of Auckland, and also young people that didn't want to have their parents signing consent forms if they were younger. Not everyone that expressed an interest proceeded to be enrolled, and then of the young people that were enrolled, 21 had depressive symptoms at baseline, and that formed the basis of the open trial. You'll see really good completion rates and 3-month follow-up rates as well. If we looking at the results there, I was fortunate that we could put a question about sexual attractions, the same one from Youth 07, in the randomised control trial, so could compare the young people from the open trial to the RCT, and found that sexual minority youth were more likely to complete treatment compared to the exclusively opposite sex attracted young people from the larger randomised control trial that had done either treatment as usual or SPARX. 85% of sexual minority youth thought the treatment would appeal to other young people. The depressive symptoms reduced from pre to post intervention and were maintained at follow-up. And that's as measured with the Child Depression Rating Scale revised. And then I did a series of semi-structured interviews after each young person had finished using the program. I asked them whether or not they thought Rainbow SPARX could help them feel better. And Troy, who was 16, that's not his real name, said, yes, it made me feel a lot better. I've been much happier because I was able to relate and use the information that I learnt to better my situation. And Bob, also not his real name, that was a pseudonym he picked for himself, said it worked for me. And the other intervention is one that's targeting bullying, specifically LGBT bullying in schools, and that's based on the Rainbow Youth Education Program, which has been about for, I think, around 20 years. So it's not a new education package, but the evaluation, the formal evaluation is a new thing. It involved 237 Year 9 and 10 students from 2 schools. This was all students in the class, so we didn't sort of say you had to identify as being LGBT and come out of your class and you can come to the special workshop. No, we did it as a sort of class-based experience for understandable reasons. And the students did a 1-hour workshop on sexuality and a 1-hour workshop on gender diversity. It involved a young person telling their story and what the experiences were like, a sexual minority young person for the sexuality workshop, a gender diverse young person for the gender diversity workshop. And the schools, it's mixed methods design. We did pre and post workshop questionnaires with qualitative items, and the young people said that the school climates, they perceive them to be hard, bullying and mocking for LGBT students. Now that's probably not that surprising to you, but it is quite surprising if you think this is from schools that are predisposed to being supportive of these students. So this is amongst schools which you would already think are going to be more supportive and positive towards these young people, and I think that's very, it's a really interesting finding. And more than 3/4 believed that the workshop would help reduce bullying. That more than 90% recommended the workshops to other young people, and that the workshops did lead to a significant increase in understanding and valuing of LGBT youth and people more generally. So in conclusion, LGBT young people are at increased risk due to environmental factors. Like Moira was saying, it's not that they are inferior in any way, they're just having environments that can be really, really challenging. And Rainbow SPARX is a targeted intervention for those struggling with low mood, so it's helping to address one of those risk factors for suicide in terms of managing depression, which we know is such an important area. And then Rainbow Youth's education package is an intervention, a school-based, a school-level intervention targeted at reducing bullying of LGBT students in schools. And now people might be thinking, wow, just that's such a specific population, we don't need to worry about the ones, there's 90% of students who won't be affected by LGBT bullying, but the emerging research is showing that actually this bullying is really toxic to heterosexual students and cisgendered students as well. So it has a negative impact on everyone, it just has a really negative impact on the LGBT young people. So those are 2 potential ways forward. Thank you for your attention.